When you are sending your kid off to school and they have a medical diagnosis where it's life-threatening, you are trusting the community that you're sending your child to, the school that you're sending your child to, that they know how to take care of your kid. Camp 1 is a week-long day camp for Manteca Unified students who have type 1 diabetes.
Type 1 diabetes is when a person, their pancreas does not create insulin, so they need external insulin provided to them to reduce their blood sugars. This is really important when it comes to the carbohydrates of our district. We have the carbohydrates on every menu listed, and that is so that these students are able to eat freely and have whatever they want on the menu. They don't necessarily need to watch carbs, they just need to know how many carbs that they're eating so that the nurses can properly dose them.
The primary goals of the camp is to help students better manage their day-to-day lives when it comes to type 1 diabetes. Throughout the camp, we work on maintaining a healthy lifestyle through activity like physical education, through healthy eating, and just provide them a little more comfort with the staff that help them during school and just a little more comfortability with themselves.
We have a number of students across our district that have type 1 diabetes, so it's a great option for them to come together and they get to meet students who are just like them, who are going through the same thing that they're going through, and they get to see their friends from last year, and you can see those lasting friendships that they've started to create.
It's evolved from just nutrition and health services running this camp to now we've got other folks participating in it. So this year we've hired teachers who are going to be conducting educational activities. Like we've got a science teacher who's going to be doing STEM with our kiddos, and we've been able to hire some PE teachers.
Nutrition education really does a lot of the back work to get everything going, make sure that we have all the food for all of the students, planning the activities, and health services really comes alongside to help support. We've done activities where they got to build their own overnight oats or build their own breakfast pizza, where they got to see the measuring pieces of that. Okay, now how do we count the carbs for this? What does that look like for your insulin? And kind of walk through that whole process from starting a meal, making the meal, and then how to dose for that meal that they're going to eat.
For the meals, we're trying to find meals that are going to be high in protein, also high in fiber, because that's going to keep the blood sugar more stable, and try to not have so many excess added sugars, which are kind of empty calories and going to just raise their blood sugars really fast.
We have to be real intentional when we are scheduling. We can't just say, we're going to run and play all day long, because if their blood sugars do crash, we have to know what to do. We have to make sure that there's a nurse there that can provide any services. We have to make sure that there's somebody that can administer any medication that needs to be administered, and just be real intentional about the schedule and make sure that if we're planning a physical activity where blood sugars could drop, there's a less strenuous activity afterwards.
Overall, it's just a really good opportunity for students to get to connect with other students, but they also get to connect with their nurses in a different way too, because typically the students that see their nurses at school, they come in, they do their lunchtime care, they're there for a few minutes, they talk with the kids, they have a good time, but through the camp they get to spend all day, and the nurses are there throughout the day. So the nurses also get some more time that they get to interact with students, the students get to interact with their nurses, and build those bonds as well.
That was something that we realized the first year. Was we had a parent who was terrified. They were sending their baby to school with adults that they didn't know and they didn't trust. But by the end of camp, they were able to see that there are adults in the school setting that really care about each and every kid. And they were able to connect with the nurses and see, hey, this is the nurse that's taking care of my kid every day. I can build a connection with this nurse, and they did, and I can send my kid to school, and I don't have to stand in the parking lot monitoring my kid's blood sugar all day because the nurse is going to do that.